Hey guys, I'm here today to talk about something that's very near and dear to me, which is nursing. I've received a lot of inbox emails about advice, tips. I'm trying to do it, or I'm in it. Second year, third year. Can you give us advice, or tell us how you got through this XYZ. So I'm here to do that. Nursing is an excellent field for those who are prepared and really seriously interested in it. I know a lot of people think that going into nursing and being a RN or a LPN or etc. is a stable career and money and etc. The fact of the matter is, if you're getting into nursing just for the money, you're not going to make it. You really have to push yourself, and you have to have something bigger than money, because the nursing program is like hell and back, basically. It's really a tedious major to have, and you have to take it serious. You have to be prepared. You have to know the material, and if you don't, they will kick you out without hesitation. They don't care if you have kids. They don't care if you work. They don't care if someone in your family died. There's 1,000 other applicants who are there and willing and able to take your spot without hesitation, without all the extra drama. So you need to be prepared, you need to be ready. So I'm just gonna make this video just to give some tips and advice. It's gonna be really general. I think I'm gonna do separate segments going into details, maybe semester by semester, what you can expect, going through each, pretty much outlining what it would be like to get to RN BSN status, and even an advanced master specialized degree. So let's basically get started. The first thing you need to know is that you need to have a passion. You have to be compassionate. You have to genuinely care for people and their well-being and their health. That's pretty much the primary reason why you're a nurse. You have to care. You can't go into this field not caring, because you're gonna get fired. You won't even make it through the program. So getting started, I would say, if you're in high school, or if you're just newly fresh off the bat, you need to basically get all your prereqs done, which is like English, sociology, psychology, general chemistry, history, foreign language, things of that nature. I would definitely recommend, if you are going to do a foreign language, definitely Spanish, or like Mandarin Chinese, or I think Russian is really big. Yeah, definitely. You'll see why. What else? I definitely would say, for your prereqs, there's no excuse. You need to be getting A's in those classes. The competition to getting into the program is really stiff. So if you don't get A's in these generalized, broad classes, you're pretty much setting yourself up for failure. You definitely want to try to get A's in those bad boys. It's the easiest classes that you're going to be able to get the A's in. Basically, once that's done, you need to go into your core anatomy, physiology, microbiology classes. You need to take chemistry classes. So I would definitely recommend, if the science area is not your forte, you need to start early while you're taking the light classes, and start getting a For Dummies book, or a simple book, so that you can have a really good foundation. Because with each science class, the harder it's going to get, the more in-depth in details. The devil's definitely in the details. You need to know this stuff like the back of your hand. once you're in those classes, obviously you want to shoot for an A minus, you know, at the lowest, I would say a B plus. If for some reason you don't do well in those classes, and by well I mean at least a B, and even a B is kind of shaky. Because once again, it's not how it was a few years ago. Like, competition for nursing schools are definitely getting stiffer and stiffer, and the later that you wait, the more people are going to jump on the nursing bandwagon, and it's just going to get harder. So you definitely want to take the chance now with the lower level courses and ace those, because it gets harder. It's going to get to the point where you're in the program and you're just praying to God you get a B minus, because in some programs, my program, if you get a 78 or below, you're out the program. I think you get one probation and you have to retake that class, and if you don't do well, you're out the program, because they need for you to know the material. They need for you to not hesitate with this stuff. And like, when you take the NCLEX, you need to pass that bad boy with a 75, because if you don't, not only did you just waste $200, you're going to need to retake it, and I don't know, it's just a waste of time and money. So you need to be prepared, and they really care about their pass rate. Like, that's bragging rights for a school. So if you don't pass, they're going to be done with you. They're going to be like, peace, we'll get someone else. We take your money and you're out the program. Deuces. Good luck, being something else. So you need to know right off the bat that they don't care about what's going on outside of your home. You're there. You joined this program. They expect that you know the commitment and you're willing to put in the time to do what you need to do in order to pass the NCLEX, because that's what matters at the end of the day. Once you get into a specialized field, which I think I'll do a separate video about that, things get a little bit more tricky. There's definitely other factors that come into play outside of grades, but initially getting into the nursing program is definitely about grades. I know some people are like, oh, you can get recommendations if you have like experience volunteering at a hospital. That's all good, that's all fine, it's all dandy, it looks nice, but at the end of the day, it's your grades that matter. So once again, with the lower level courses, definitely try to ace those with A's. I would say, as far as the GPA wise, for them to even really consider you, you need to have like at least a 3.4, 3.5, just for them to look at you. I know some schools are like, oh, try to have a 2.5 or a 2.0. That's the minimum standard. And once again, the field is getting more competitive by the semesters, so you need to make sure that your grades are definitely up to par. And by up to par, I mean an A or a B plus. B, the lowest. If you have a C, especially a C in any of the science courses, you definitely need to take a step back and reevaluate what's going on, because if you can't get through like an anatomy course or a microbiology course, getting in and actually taking the actual nursing classes, you're going to get destroyed. So you need to take a step back and look at your study habits. You need to look at what you actually don't understand. Definitely get a tutor if you need to. It's definitely a reality check when you get in there. There are no babies in there. I've seen people go home crying. It's at least one person that goes home crying every day. It's people who get kicked out the program every day. You'll start off with a class of 50 people, and then when it's all said and done at the end of the class, half the class is gone. So that's just life. So definitely you need to have your game face on. You definitely need to be able to put in the time. You need to get rid of toxic people in your life. You need to take a step back and say, these are the people that are in my environment. I don't want to, I'm trying to do this. I can't really have them in my life like that right now. And that's perfectly fine. I had to cut a few friends. I had to take a step back. I had to keep people at a distance, because you really don't need distractions. You don't need people with drama in their life that can potentially spill over into your life. So you take a step back, you let them do whatever it is that they're doing, because you have a goal and you need to do whatever it is you need to do in order to accomplish it. A lot of people ask me, oh, is it okay if I work and I'm in the program? I'm not going to say that it can't be done, but for every hour that you spend in class, you need to be at least studying 2 hours outside of the classroom. So studying is kind of like a full-time job. I actually worked prior to doing nursing, and I saved up my money. I was like, you know what, I'm not spending anything, outside of like rent, food, and that's it. I saved up my money, and I was like, this is my money to get me through school, to take care of rent and food and other necessities, because I'm not going to be able to work and do this. It's really hard. It's really, really, really hard. I'm not going to sit up here and lie and be like, oh, it's possible. It is possible, but it's hard. It's hard to have other distractions in your life when you're trying to accomplish this. This is a huge task. You're responsible for the care of another person, someone else's well-being. So you need to be focused on that. And how can you be focused on that when you're at a job 40 hours a week doing whatever it is you're doing and focusing on that? And yeah, that's my answer to that. If you think you can do it, but you need to have a backup plan and tell your job deuces if you can't. At the first sign of you getting a bad test score or a bad quiz score or a bad checkup or whatever they want to, label their test as, you need to tell your boss, like, I'm out of here. And you need to let them know up front, so, you don't have that haunting you. But yeah, I basically saved and I made arrangements. I had a plan. I was like, I'm not going to be working. I need to get my A's, and I need to knock this out the ballpark, because I don't want another person taking my spot because I got a B when I could have got an A in the class, So once again, do what works best for you. This is just my advice. This is just me being logical, and I know some people live in a fantasy land where it's like, oh, I can do this, that, and that, and it's hard, I don't want to say you can't do it, but it's hard. Don't make it harder on yourself. I know that everyone, needs income, but if you want to take a step back and say, I'm gonna have to work and go to school, what you may want to do is just like take a year, pump the brakes on nursing, work triple time, quadruple time, save all that money, save it, and then enter the program, tell your job deuces, and enter the program, and just know, like, I have the time. There's no excuse as to why I couldn't get something done, because there is no excuse. You can find a way. You can make a way. It's going to be hard. Anything, worth having is going to be hard. And that's just life. So deal with it. You got to put your big girl panties on, or your big boy boxers on, and keep it moving, because there's no sympathy in this field, especially for nurses. You're going to get shit from the doctors, you're going to get shit from the head nurse, you're going to get stuff from the patients, you're going to get stuff from your professors, you're going to get stuff from other classmates, colleagues. It's going to be coming at you in 5 different directions, and you need to be prepared for it. And it starts, it starts at the very beginning. It really does. What else? Study habits. Once again, for every hour in class, you need to take 2 hours and study. What I do is I make note cards. Yeah, I'm a note card girl. I have a whole bag filled with note cards. I lie to you not, filled to the brim of note cards. And Um, what I do is I'll look at them, I'll break the material down because it's going to be a lot. It's going to be very detailed. I will read the book first and I'll say, okay, I'm done with you. We have like packets and stuff. I will make note cards and break that material down into segments, and what I'll do is I'll look at the note cards 15 minutes, then I'll walk away from it for a half an hour, then I'll go back to the note cards and review it 15 minutes, and that's what my day consists of. I cannot, it's really hard to like cram and sit there for 2 hours and think that you're going to retain all that information. It does not really work like that in real life. So to me, it would be a lot easier to break that material down and to study it in increments throughout the day. So I might, when you add up all the hours of me reviewing the note cards, I might look at them maybe almost 4 hours a day, just like looking at it, memorizing it, retaining it, able to explain what's going on, what's happening here, why this is taking effect, what's going on, you know, with etc., 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 this case study, or and then I'm able to walk away from it so that I'm not overwhelmed, and it works for me. So I don't know, maybe, you know, that'll help you, but cramming definitely isn't going to help you. What else? Try to find a study buddy. It's really nice to have someone in your class that, you know, is going through the same thing, having the same, and it's good to vent, but you don't want to, like, turn it into a bitch fest, because then nothing gets done. That's just the way that it is. Try to find an outlet. Like, for me, it's study, 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 study. But then, like, you know, have a date night, or I try to like take time for myself at least once a week where I'm like, screw you, school, I'm doing me. And normally it falls on a Friday, Saturday, or Sunday too. So that's just that. Try to get a medical or surgical textbook. It'll definitely come in handy. Do it while you're taking your prereqs so you can become familiar with the medical terminology. Let's see. You definitely want to stay organized, because it can easily spiral out of control, and then you're just overwhelmed and you're lost in all the material and clinicals and this and that and trying to remember everything. So stay organized, even if it means putting everything in your cell phone, which I don't advise, because anything can happen to your cell phone and all that information is lost. But hey, that's just me. Get a planner and plan, you know. Let's see. Oh, some classes are designed to weed people out, FYI. Like, if you are having difficulty and that class just seems like really, really challenging and difficult for you, it probably was purposely made that way. Once again, they don't want people in this field or genre who, you know, aren't going to pass the NCLEX. You're just wasting time. They will take your money, but, you know, you won't make it through the program. They'll say, oh, you know, so sorry, we took as much money as we could from you, goodbye. And then they'll have another person come in and pay money, and, you know, that's just it. Once again, with the classes, they're no joke. It's kind of like a one-shop deal. I think if you get a C or below, and by C I mean anything lower than a 78, they'll put you on probation. They'll be like, if you mess up again, you're out of here. Yeah, so what you want to do is just avoid being on probation, because it's just not a good look at all. Some people are like, thank God for the 79 or 78, because, you know, that C means continue. So it's different for different programs, though. I think some programs you can get a 75, but yeah, you definitely want to keep those grades up, which means you definitely need to know the material, which means you need to be studying. Unless you're a genius and you just know all this stuff off the bat, or it comes to you easily. But that's pretty much all the general information. I can go into details, but I think I'm going to do it in segments, so that way I can cover everything, and people, you know, they know if they're experiencing it or going through it, it's rough, but it's doable. That program is definitely doable if you apply yourself. It's not for the disorganized. It's not for the people who don't take it serious. It's not for the people who are trying to get in there just to make money, because you'll be like, the money isn't worth this, you know. I can go be a investment banker and make more money and not have to go through this, you know. So it's not about the money, that's for sure. It's tedious. It's doable though. I would definitely say it's doable if you apply yourself and if you do everything that you're supposed to be doing. There's no reason why you can't get through the program. Once again, for specialty fields, it's a little bit different, so I'm gonna have to do a segment about that. But I'm trying to see. If you have any other questions, you can definitely inbox me or comment below, and I'll definitely get back to you. Someone asked me like, oh, I failed out of nursing school, what can I do now? There's other options. You could be a LPN, a medical assistant, a nursing assistant. You can do roles behind the scene. You can get into like the administration part of it, or the medical billing or coding part of it. It's not as involved as far as patient care, but you know, you're still needed in those fields. We need, you know, people. That's not for me though, because I kind of like the interaction with people. I like I don't know, being at the epicenter of it all. I definitely am doing acute care for sure. Trauma. So yeah, I definitely am going to be doing that. Trying to think of anything else. Anything else general aside from study. The sad part is, literally when I go to sleep at night, the last thing I do is study. And when I wake up in the morning, aside from like brushing my teeth and eating, I'll like pick up a note card or review some material. So it's already like embedded in me. Like, I'm so desensitized to like note cards. I'm so desensitized. I'll be in my purse and I'll be in a supermarket. I just whip out some note cards, you know. So they're everywhere. Everywhere. But that's pretty much it. If you once again have anything in particular that you wanna know, just inbox me. I hope, you know, this video didn't discourage anyone. It's definitely not for that. It's to make you aware of how it really is, and I definitely don't want to sugarcoat this stuff, because they will definitely sugarcoat stuff, and then when you get in there, you're like, why is this happening to me? And everyone's nervous, and like no one wants to be like, oh my god, this is so hard. Because, you know, they want to be like, oh, it's so rewarding, it's so, you know. But it is. It definitely is. It gives you like a purpose. You feel good about yourself. But they also need to mention, like, this is no joke, you know. This is no like walk in the park. Everyone that's a RN, everyone that's a doctor, everyone that's a hospital administrator definitely got those positions. They deserve it for the most part. They definitely put the work in. They definitely, you know, put the work in. They know their stuff, even if, you know, they're low, like if they pass their NCLEX with, you know, the lowest possible score, they still pass, and it's really a difficult major. So I wouldn't even look at it, you know, like that. If you that's why it's pass or fail, because if you pass, you know the material, you know what to do, and you're not, you know, likely to kill someone. So that's pretty much it, guys. Until next time, deuces.